Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah walhamdulillah wassalatu wassalamu ala rasulillah. First of all, Jazakallah khair for the opportunity. I'm really thankful, especially to Hanan, for asking us to present myself and Dr. Rania. Part of the reason why I like presenting on this topic is really for students and for early practitioners, because when I was in the early stage of my development as a psychologist, I had developed a certain mindset based on my training. When you are trained under these supervisors, you begin to narrow your mindset and you don't recognize the problem of reductionism. And people like us, brown people who come from places and countries where we were once occupied by colonialism, and some of us are still occupied, unfortunately, not physically, but our mindsets are still occupied. We don't recognize the problem that if we're given something, that we don't ask questions, which not only goes against the logic and rationality itself, but it goes against the very nature of who we are as Muslims, that we are taught to ask questions. The Quran challenges us to ask questions and to challenge and push what's thrown at us. And so, we come from India and Pakistan, and we were ruled by the British. And so whatever we're given by the West, whatever we're given by the white people, we just take it and swallow it as a whole. And then there's nothing wrong with, of course, a lot of these theories have a lot of ground and rationality and logic and research behind it. So I'm not here to say that you should reject all of it. That's certainly not the point. But we have to ask questions. So part of this presentation and my goal behind this is that I want to plant the seed that we have to begin to ask questions. So I'm going to talk about how some of these theoretical models came into existence in the West. And I'm going to actually start with the current state of mental health, because it's important to recognize that when you see, for example, a building, when you see a tree, and you see how the tree is not in a good shape, or a building is falling apart, then you ask a question that, okay, if a building is falling apart, or if it's coming down, then the builder didn't do a good job. Then there's something wrong with the foundations of it, right? And so we'll talk a little bit about the current state of mental health, and then I'll go into the need for Islamic psychology and what that really looks like, inshallah. So, I pulled some statistics for Australia, because I think, given that most people, I think, are from Australia who are registered for this, and it's based off of Australia. But in Australia, 20% of Australians aged 16 to 85 experience a mental illness in any given year. Suicide is the leading cause of death in Australians 25 to 44, and the second leading cause of death for Australians aged 15 to 24. Every day, 30 Australians will attempt, and at least 6 will successfully commit suicide. Depression has the third highest burden of all diseases in Australia, which means that there's a total impact of a disease measured by financial costs, mortality, morbidity, and other indicators. And depression is the number one cause of non-fatal disability in Australia. That's the state of mental health just by these two factors. And I didn't even look at bipolar and psychosis and other mental health issues in Australia. Now, in the United States, where I live and Dr. Rania is, 1 in 5 have a mental health condition in 40 million Americans. If you go by mere numbers, youth with severe depression increased from 5.9% in 2012 to 8.2% in 2015. Now, with COVID-19 and currently what's happening here, these numbers have increased even more significantly. More Americans now have access to services and have health insurance. So it's not that people don't have access to services. So you can't make the argument that, these numbers have increased because people don't have access or people don't have insurance. With Obamacare having more insurance, you would think that people would have more access and people could do better, but that's not the case. Still, 56% of adults with mental illness do not receive treatment, right? So mental health system is in bad shape. And people who do receive treatment, they end up not doing so well. 9.6 million people experience suicidal ideations. Okay, nearly half have a co-occurring substance abuse disorder. Okay, 56% of American adults have mental illness that do not even receive treatment. And so these numbers should shock you, and not only should shock you, but the question that I want you to think about is that you have countries like Australia, countries like the United States, which are leading in healthcare. Okay, and you can pull these numbers from any Western country. Okay, we're not talking about third world countries like Pakistan or African countries. We're talking about Western countries where research, where healthcare systems are supposed to be on top of the line, yet still we have these kind of numbers and this kind of statistics where people are dying because of suicide, where people are dying because of mental health issues. Why is that happening? Why is that still the case? Okay, so I want you to think about that as our premise as we move on with this presentation. So mental health system is failing, and my my hypothesis is because of weak foundation. So why do we have that weak foundation? So there's a beautiful article which actually is on qualitative analysis and qualitative research by Collins and Stockton, published in 2018, and in there they say that knowledge production has generally been socially contextualized and undifferentiated from values of time and place. The social context, the worldview, the values of the time and place will determine what knowledge is being produced, right? And it makes sense to you, right? So whenever, whatever is being taught in schools, whatever people think about, whatever people theorize, whatever people do research on, has to do with the different values that exist during that time. Certain groups will have certain privileges based on their race, ethnicity, and gender. So, there's a reason why, if you look in the field of psychology, especially some of the earlier theories like Freud and earlier developmental theories that we look at, most of them were white males, right? Why is that the case? How come we didn't have any African Americans? In fact, a very beautiful developmental theory that came from Vygotsky, right? Now, unfortunately, Vygotsky was Russian, and even Russians didn't like him because I think he was anti-communist or something. So he had a really nice developmental theory, but his developmental theory wasn't accepted because he wasn't from the dominant race or dominant ethnicity. You see what I mean? And then power determines who produces knowledge. It's not really the knowledge itself or the value of knowledge or how good the knowledge is. It's actually the people who hold power. What is being researched is also dependent on power and what social agendas are being pushed. Okay, so you have to keep that in mind, that the theories that exist now in the field of psychology, why CBT, why is it, you have to ask the question, especially in the US, why is it that cognitive behavioral therapy is so popular? Okay, now in the US, the two big giants in the US currently are the insurance companies, okay, and the pharmaceutical companies, okay? And CBT, unfortunately, is very popular because it works well for the insurance companies, right? Insurance companies don't want to pay for, 20, 30, 40, 50 sessions for a psychodynamic therapy. They would rather pay for 8 to 12 sessions CBT. It's manualized, it's structured, you can measure thoughts, and we'll talk about what that looks like, right? You can do all of that. So they would rather pay for 8 sessions or 10 sessions or 12 sessions and get it out of the way. They're not going to pay for 20, 30, 40 sessions of psychodynamic therapy. So they're going to funnel all the money that they can into passing laws, into research, right? To make sure that CBT gets pushed, into making sure that CBT becomes the evidence-based practice, for treating whatever it is. So recently, the APA issued guidelines for treating PTSD, and they took out psychodynamic theories from it, and CBT was the top. And there was a huge problem with that. And for them, the gold standard was randomized controlled trials. And there was a huge issue and a huge uproar because everybody was saying, well, how could you do that? That's because all these companies, insurance companies, pharmaceutical companies, they don't want that. The pharmaceutical companies would rather have people take medications because medications work easy. People, they don't have to pay for therapy sessions. Instead of 8 to 12 therapy sessions, somebody can take medications, and it's cheaper and easier for them. That's the problem. That's what produces knowledge, unfortunately. It's not the value of knowledge. It's not, what makes a theory powerful. It's what is cheaper. We live in a capitalistic society and capitalistic world. And so that's what causes the problem here, unfortunately. So let's look at some of the worldviews that existed, right? So, we started off with the pre-industrial, industrial revolution. And so some of the worldviews that existed, we had a lack of concern for children in the beginning. And so we see a high infant mortality rate, where we had only 1 in 3 to 1 in 4 chance of kids surviving to a adulthood. Like, for example, in Paris in 1750, 33% of all children born were left in foundling homes or on doorsteps, and most of them died. Thomas Hobbes, who died in 1679, and the Catholic view of the original sin, which produced a very negative view of children. A concern with the view that children are born evil and need to be disciplined, right? That was the view that existed at that time. Okay, so keep that in mind, because that view helped shape the theory that comes with the psychological theory, which we talk about, which is the Sigmund Freud's psychoanalytic or the psychodynamic theory. Okay, then comes John Locke, who dies in 1704. He comes with the whole mechanistic approach. Okay, that he publishes an essay concerning human understanding, which revolutionizes how people see human development. He coins the term tabula rasa, which is a blank state, that it is environment and sense perception that leads to development. Right? Everybody comes with a blank state. After that, comes in 1778 is Jean-Jacques Rousseau. He comes with the organismic approach, which is the opposite to the mechanistic approach, and laid out his view on development, that children are actually born good. Okay, so you see we move from children being born negative to children being born neutral to children being born good. Again, these are worldviews, right? We're not even talking about psychological theories. That they have the inborn capacities that allow them to develop along an optimal path and become valuable, good adults. What's happening in research? So we have observational research in studies on human development. 1787 is the first known published account on baby biography by Diedrich Tiedemann. 1882 is the first child development textbook by Wilhelm Preyer. And then we shift to theoretical science. John Watson in the 1920s at Johns Hopkins took the work of Pavlov. Behaviorism comes. Behaviorism is powerful because you can begin to now quantify behavior and psychology. All right, all of these theorists, they are untrained theorists, right? You compare some of these people. I mean, I'm just going to be very blunt here. If you compare Freud or Erikson or Bowlby to like the likes of Imam Ghazali and Imam Razi and those, we're talking about polymaths, people who not only studied medicine but mathematics, but psychology and all multiple, and there were like Hafid of the Quran, and they studied the Islamic sciences, right? They studied for decades upon decades before they even wrote a single a paper. Okay, but we have people. Freud was just a physician. He wasn't a psychiatrist or a psychologist. Erikson had no formal academic training beyond high school. Bowlby was just a therapist. Piaget was a philosopher and a biologist. And Vygotsky was a lawyer, and he turned into philosophers. These are untrained theorists. They have no background in philosophy, right? But they're coming up with theories. So their theories are based on worldviews. They're not based off of any philosophical background, any backing, or anything. It's kind of like somebody who was sitting there and had a thought. I think this is what's happening based on their experiences, their background, what I talked about earlier, the onto-epistemological approach. And, their social milieu, social context. And based on that, they come up with a worldview, and they come up with a theory. They write on it, and because nobody else had heard of anything different, or this looks unique, and people start talking about it, and it becomes popular. All right, and also power and influence plays a role here as well. All right, so let's look at now theories. We have the psychodynamic theory. Freud, Jung, and even Erikson can go in there. So what does the psychodynamic theory say? Human beings are born evil with this innate tendency to acquire pleasure, avoid pain. All behavior is a result of unconscious, irrational, and instinctive forces such as the id, ego, and the superego. And then comes the humanistic approach, which is the Rogers and Maslow, that human beings are born with capacity to self-actualize. We have the behaviorism approach, Watson and Skinner. The environment is that what influences behavior. It's not the innate drives. Then comes the cognitive approach with Piaget and Vygotsky. The internal processes, our cognitions, our thoughts are what influences behavior. And then we have now, in the last 2-3 decades of the brain and whatnot, the biological approach that it's the genetics and the physiology is what determines our behavior and our psychology. So these are some of the dominant theories and paradigms that exist in the psychology world today. So now, if you put it all together, here's what's happening here, right? These are all reactionary theories. Somebody comes up with a theory, and somebody else comes up with a theory as a reaction. So psychodynamic theory comes up and says human beings are evil. Humanism comes up and says, wait a second, no, human beings are not evil, actually they're good. They have the capacity to self-actualize. Psychodynamic theory says, well, human beings have unconscious drives that are prevalent and that prevail and that determine behavior. But then behaviorism said, no, it's not the unconscious, it's not what's inside, it's what's on the outside. It's the environment that determines, right? The external observable environment. Well, then the cognitive theory says, wait, actually it's the internal things. It's because unconscious things, even according to Freud, even the person himself or herself doesn't know what's happening inside, right? Because they're in the unconscious, the subconscious. So I don't even know that I'm having these dirty thoughts about my parents or whatever he conceptualized, right? And so I can't measure it, obviously. If you asked me what's in my unconscious, I wouldn't know. Well, the cognitive people said no, it's about the thoughts, because I can measure my thoughts. If you ask me what I'm thinking, I can tell you what I'm thinking, right? The biological people say, well, no, well, it's not just the thoughts, it's actually stuff you can measure. You can hook your brain up to something. If you're having a thought, just think about it, and I can tell you what part of the brain lights up, and then, that's what really matters. So you see, it's a reaction to what somebody's saying. And there's truth to some of these things. So I'm not, again, the idea is not to reject this because they're reactionary theories. The idea is the way that they were developed. That's what I want you to focus on, is that the way they developed were reactionary, and that's why we have to be cautious. That when somebody has it's kind of like, when husband and wife fight. When I work with couples, I say when you have an argument and it's a reaction to someone else, you have to be cognizant that you don't respond to someone's reaction. You don't take reaction at face value. You have to take a step back and say, you know what, this was just a reactionary response. I'm going to take a step back and I'm going to think about it again, and then I'll come back and then I'll have a response to it later. Okay. Now for those of you who have heard anything that I've ever had to say, you'll know that, my spiritual mentors, Allama Iqbal, Muhammad Iqbal, may Allah bless his soul, that he comes up and shows up in my presentation, whether you like it or not. So Allama Iqbal, in one of his poems, he challenges psychologists. So he says in Urdu, he says, "Jurrat hai to afkar ki duniya se guzar ja, hai behre khudi mein abhi poshida jazire, khulta nahi is qulz mein khamosh ke asrar, jab tak tu ise zarbe kalimi se na chire." He says to the psychologists, he says, go beyond the world of thought if you dare. There are still unexplored islands in the ocean of the self. This silent sea will keep all its mysteries hidden from you until what? Until you strike to part its waters with the staff of Moses. Iqbal challenges the psychologists that, look, if you want to uncover the mysteries of the self, if you want to uncover the secrets of the self, then you have to use what? You have to use... Because Musa alayhi salam was a very powerful man. He already was very powerful, right? Because what did he do? He punched a man, and a man died. And that's what happened, right? He saw two men fighting, and he punched one of them, and he was so powerful that when he punched him, the man died. And the next day, he was about to do the same when the man stood up and said, "Are you going to do the same thing what you did yesterday? Is that what you're trying to do? Create fasad in this world?" And Musa then ran away from Fir'aun, and then he was saved. So he was already a very powerful man. But when he got this stick from Allah subhanahu wa ta'ala, this power from Allah subhanahu wa ta'ala, that he struck, right, the sea split in two. So that's what he's saying here, Allama Iqbal, is that when you take the knowledge, when you take what you get from Allah subhanahu wa ta'ala, and then you strike this ocean, the ocean of the self, then you will see the secrets that you have, that you will uncover the secrets that you have not uncovered from before. And that's what I want you to understand. That's the takeaway message, that we're not using, unfortunately, we're taking what we get from others and we're swallowing it as a whole. Instead, we're not using what we have already been given from Allah. And that's what we need to do. Right? So that's what we'll focus on for the other half of this presentation. So what are some underlying assumptions of Islamic psychology, especially our model, the traditional Islamically integrated psychotherapy model? First of all, epistemology and ontology is not based on the reactivity or worldviews. Okay, that's not how we look at it. that does play a role, but that's not where it originates from. Human beings are born with a fitra. This comes from the hadith of Rasulullah. Kullu mawludin yuladu ala fitra. Every child is born with a fitra. Every child is born pure and good. Okay, and so we obviously reject the notion that the psychodynamic theory proposes. Health and wellness are on a spectrum, meaning just because someone is not diagnosed with a disorder does not mean that they cannot get help. And by the way, some of the theories now talk about that as well, right? There's theories about how a person can be on a spectrum of languishing, and I forgot the other end of it. And then focus and goal setting is it goes from primordial life to postmortem. So when I do something evil in my life and I feel bad about it, it's because I made a covenant to Allah subhanahu wa ta'ala. And then when I make a goal in my life, like when I make a goal, like I need to start a business, right? I'm going to school, or I need to do this or that, I need to get married. That goal of being married is not just based on this world, rather it is also based on the hereafter. It goes to post-mortem, you see? So that's an assumption we have to keep in mind. And as a practitioner, the therapist's internal factors are equally important in the facilitation process. That you are also on a journey and you continue on that journey, and because that's important when you're working with clients. Sources of knowledge, asbab al-ilm. As Muslims, we believe that there are three main sources of knowledge. First is sensory source of knowledge, things that we see, things that we feel. Allah subhanahu wa ta'ala encourages that in the Quran. He says, إِنَّ فِي خَلْقِ السَّمَاوَاتِ وَالْأَرْضِ وَاخْتِلَافِ اللَّيْلِ وَالنَّهَارِ لَآيَاتٍ لِأُولِي الْأَلْبَابِ. That indeed in the creation of the heavens and earth and the alterations of the night and the sky are signs for those who are the men or the people of understanding. The second source of knowledge is khabar, like for example wahi, Quran, Sunnah. This is a source of knowledge for us as well. And the third is rationality and reason. This is aql. This is the source of knowledge for us. And some people don't recognize this, but these are all equal when it comes to Islam. Islam, like for example, just because gravity is not mentioned in the Quran doesn't mean that we reject gravity. Why? Because it makes sense. It's a rational. And so Iqbal even talks about this idea of intuition. He says man is endowed with the faculty of naming things. That is to say, forming concepts of them, and forming concepts of them is capturing them. Thus, the character of man is knowledge. The character of man's knowledge is conceptual. And it is with the weapon of this conceptual knowledge that a man approaches the observable aspects of reality. Right? This is innate inside of a human being. And so that's why it has an equal value as even in khabar. All of this, empirical knowledge, revelational knowledge, rational knowledge, inside of that is mental health for us practitioners. That when we're looking at mental health, we're looking at all these things together, and we're conceptualizing it within these three frameworks, and we're not differentiating between them. If there is any contradiction, any ta'arud that comes between these sources, we understand that to be only apparent, and we demand resolution through either some reconciliation, some tatbiq, some abrogation, if there's going to be some naskh, or some interpretation. So meaning there's room for a discussion here, right? So we don't some people say that, if it's in the wahi, like for example Imam Fakhruddin Razi said, and this was his view, and again people could be wrong too. His view was that when you have something like rationality and you have something that's in, for example, wahi, right, in the Quran, in the scripture, and let's say they both come into some contradiction, okay, rationality and scripture, you cannot simply reject rationality. And his argument was, he said, if you reject rationality, then you are also rejecting scripture. Why? Because it is the rationality that is used to accept scripture in the first place. Do you see the argument? Because the reason we accept scripture, to accept Quran, is through rationality. And so if you throw out rationality, then you're automatically throwing out scripture. So some people make the argument, it's in the Quran, therefore we throw it out. No, you have to have a discussion here, that maybe there's an understanding that we have that didn't make sense. Maybe something is wrong in understanding of that. Maybe there has to be a naskh or abrogation. Maybe there's some reconciliation or some interpretation that has to come through. So we don't automatically have some kind of a rejection here that happens. Okay, so let's talk about ontological framework of human psyche and health and pathology, especially from the framework of the model that we practice at the Khalil Center, which is titled Traditional Islamically Integrated Psychotherapy Model. And we have a book out that Dr. Rani, I think, also spoke about, which was just published earlier this year. So we go back to Imam Abu Zayd al-Balkhi from the 9th century, which Dr. Rani also spoke about, and he categorized pathology in two different ways. He said pathology could be exogenous and it could be endogenous. The source could come from the outside, or the source can come from the inside as well. Health and pathology, again, is on the spectrum, like I said before. So if you look at this chart here, right, that we talk about, is that a person can be anywhere on this chart. Now, in the DSM, or the way we're taught in school, is that we only work with the clinical range here. Right? So somebody comes to you, the first thing that you have to do, again, this goes back to the other issue, which is that capitalistic society, the insurance, all they care about, when you, here in the US, you can't even bill for service until there's a diagnosis. No diagnosis, no bill, no payment. So a person who's running a practice is not going to get paid, can't make a living, can't pay for, food for his family until he's diagnosing somebody, right? So what if he doesn't meet the criteria for a diagnosis? What if somebody comes in, with a spiritual illness, like somebody who has a problem of jealousy, somebody who's looking at pornography, right? You cannot diagnose somebody with pornography problem, right? Unless they have a very high rate of something in maybe an addiction, it could be counted as an addiction. That's the paradigm that we're asked to look at. But we as Muslims, we don't look at it from that perspective. So we look at it from a range of exogenous psychological functioning. Somebody could be in the clinical range, and then underneath that, somebody could have a spiritual pathology, right? From if you look at the works of Imam Ghazali, he lists out spiritual pathologies, diseases of the heart, for example. You can have hasad, you can have kibr, and for example, like Allah subhanahu wa ta'ala said in the Hadith Qudsi, like kibr, even a person cannot even have a mustard seed worth of kibr, right? Al kibriya uridai wal azamatu izari, that kibr is my covering, right? And then whoever has this in that qadaftuhu fi nar, that I shall cast him into hellfire. So we're not even supposed to have even an ounce of kibr or pride in our heart. And so as psychologists, right, we're supposed to work on that. But we can't work, obviously, within the context of the Western framework that exists. And then there's the normal range. Even then, some people might even have some issues here. And then we come to, those who might be in the saintly rank. But, from Khalil Center perspective, we don't treat these individuals here. We're not aiming to treat these individuals because that's beyond our scope. But this might be something for the likes of Sufis, Sufi shuyukh, who work with individuals. Rasulullah sallallahu alaihi wasallam said that, ala fil jasad, that inside the jasad there is a mudgha, there is a piece of flesh, that if the body is doing well, if it's doing well, the body is doing well, and if the body's not doing well, that it's not doing well. And what it is, ala fahil qalb, that it is qalb, right? And that qalb interacts with the ruh, it interacts with the aqal, it interacts with the nafs. And the ruh also, if you read the works of some of these individuals, and even if you go to Shah Waliullah, and I'll mention him in a minute, that they talk about how the ruh can also be, some people ask a question, right? Like, do animals have ruh or they don't have ruh? Do human beings have ruh that could have animalistic qualities? Absolutely can. Right, so we have inside of us part of, according to Shah Waliullah, he categorizes this into like 6 or 8 different categories. That we have this force inside of us that is driven by this animalistic ruh, that drives us to do things that animals would do, for example. Right, so ruh could be ruh samavi or ruh haywani, for example. And so if you look at the intrapsychic tension that exists inside of us, we have this pull towards Allah subhanahu wa ta'ala, and then we have this pull that's pulled by the that's pulled by the ruh samavi, and our aql is what's keeping us at bay here, right? And then on the other hand, we have the ruh hayawani here. And if we look at the nafs, which is mentioned clearly in the Quran in 3 different states, the nafs amara bisu, that brings us at the lowest level, that is this untrained animal. And then we have nafs al-mutma'inna on the other end, which most people are aware of. So what is fitra? Fitra is, again, all human beings are born with this primordial, inherently good nature. that can comprehend universal truths, that knows good from evil. If you ever get a chance, look up the Yale baby lab. There's a good clip on YouTube. I think it's by 60 Minutes, and what it talks about is how babies as young as 6 months of age can differentiate between good and bad, right? And Fitra has a recognition and inclination for the divine. Among such competing drives are what Shah Waliullah again talked about, the two main drives that exist: the Malakuti drive and the Bahimi drive, right? The angelic drive and the animalistic drive. And he talked about how both of them could be at peace, or both of them could be at tajadhub, at war with each other. So you have different states. They could be one could be high, one could be low, and if they could be at peace in opposite ends, or at war in opposite end, and that produces different symptoms. The nafs, again, Imam Ghazali calls it the untrained horse. If you read the works of Mujaddid al-Fithani, I believe he writes about it being a donkey, or gives it equivalent of a donkey, because I really like the donkey analogy, because I'm from Kashmir, and in Pakistan, if you ever see on the streets how they use the donkey, an untrained donkey is pretty funny to watch, because an untrained donkey can do very silly things on the streets, and it won't move and it won't do anything. But a trained donkey is phenomenal. Like, they will have two people working on two ends of a street a mile away, and on one end they're loading up the donkey, and they will give it a tap, and the donkey will walk 1 mile away to the other end of the street, and then they will unload the donkey, right? So a nafs, if trained, can lead you to Allah, because remember, Allah in the Quran, to a trained nafs, a nafs al-mutma'inna, is addressing the nafs. It's saying to the nafs, Ya ayyatuha nafs al-mutma'inna, right? Irji'i ila rabbiki radiyatan mardiyya, and then says, Fadkhuli fi ibadi, that enter with my servant, wadkhuli jannati. So a trained nafs can take you towards Allah subhanahu wa ta'ala, but an untrained nafs, right, which is the nafs al-amara bis-su, which is mentioned in Surah Yusuf, right, where the wife of the king says, وَمَا أُبَرِّئُ نَفْسِي إِنَّ النَّفْسَ لَأَمَّارَةٌ بِالسُّوءِ إِلَّا مَنْ رَحِمَ رَبِّي, that the nafs al-ammara takes you towards evil and makes you do evil things. So that's the problem with the untrained nafs. And then we're talking about aql, a trained aql, a mutafakkir aql, a metacognitive state where a person knows what they're thinking, where they think about what they're thinking, where they're aware of their thoughts, they're aware of their surroundings, they're aware of even the emotions that they're feeling, they're aware of even their behaviors, what they're doing, can be very powerful, even according to Imam Ghazali, for example. And ruh, we know as this spiritual being inside of us. Some people conceptualize it as it coming from Allah subhanahu wa ta'ala. And this is our way to connect with Allah subhanahu wa ta'ala, this inner self that thirsts for deeper meaning, purpose, transcendence. And so what we did, and then ihsas being the last element here, which what we define as basic emotions. So if you look at emotion-focused theory, it talks about how emotions at a very basic level serve a very healthy purpose for human beings. Even anger, for example, has a healthy purpose, but anger that's out of control, too much anger, can be unhealthy, can be destructive, and can be very dysfunctional. So it's not the presence or the absence of anger, rather a healthy versus unhealthy anger. So when you put all of this together, we have the model of the traditional Islamically integrated psychotherapy model, and this is what we practice at the Khalil Center, right? So you have the fitra, that is what the person is born with, that covers the entire human ontology. You have these competing drives, right? The angelic drives, the hedonistic drives, the satanic drive, the aggressive drive. You have the qalb, that we're trying to achieve this qalb salim, which is our goal here, the sound heart. And then you have the four elements here. You have the aql, the ruh, the ihsas, and the nafs, right? And our goal, or the intervention that we're using as therapists with aql, is tafakkur, right? And ta'aleem. So we're teaching the individual, and we're making the individual being more contemplative, okay? And what we're trying to aim towards is this contemplative mind. So the mind who's able to, and this is what CBT tries to do as well, right? They want the individual to become more aware of what they're doing. Awareness is the key here. With ruh, the intervention oftentimes is not just a dhikr, but this connection with Allah subhanahu wa ta'ala, spiritual connection. And what we're trying to do is kindle or rekindle this angelic spirit. The person is more connected to Allah through their ruh malakuti. With emotions, we're trying to seek transformation from their negative, destructive emotions towards their positive emotion and have more emotional regulation. With nafs, we're seeking this jihad or the mukhalafa of their nafs so that they can acquire and achieve nafsul mutma'inna or a tranquil ego. The principles of change and the mechanisms of change are listed here. So we have in the initial part, which in any therapeutic setting is obviously compliance. And that happens through having a proper alliance with the client, right? So you have to have this connection with the client, which sometimes obviously comes naturally, but some of that has to come with how the therapist responds to the client. And then after that is this self-awareness. The awareness has to be there. Some of that is through psychoeducation, and then a lot of that comes through being able to interpret for the client, help the client become more and more aware through interpretation, through uncovering. So mukashafa has to be there. The therapist has to serve that role of being able to let the client know what is happening to them. The goal is to have a balance, right? The next slide we'll talk about it. That we can't have a person going in one side or the other, right? So like, for example, with iman, al-iman bayn al-khawfi wal-raja, right? So a person who thinks that they're going to be saved on the Day of Judgment because Allah is all merciful, right? That's not a healthy thing to think. But a person who thinks they're doomed because Allah is Al-Qahhar is also not a healthy thing. So a healthy iman is in between the two. And similarly, what we talked about before, all of these elements have to be balanced as well. And so in the initial phase of that is going to be takhliya. It's going to be actually going to be relieving, especially the negative aspects, right? You can't have, our shahada begins with a la, right? First, if you're doing something negative, you have to clean the bowl before you can fill it up with something that is pure. And so we start with removing negative aspects, removing unhealthy habits, and then comes the tahliya part. Then we add more and more things, and our goal in the end, which, like I said, might be a little bit out of our scope as therapists, but if we go down this path, it may happen naturally for the individual, which is integrative unity, ittihad. This may be beyond our scope of practice as psychologists. So again, what we're talking about is that once you have this balance here, i'tidal in these areas, in the aql, nafs, ruh, and ihsas, that it's going to lead to ittihad naturally. So that's the model that we practice at the Khalil Center. And again, there are several models out there. If you go and look at the literature on Islamic psychology, this is our model that we practice. Certainly, Islam, beauty of Islam is that this knowledge here is not qat'i knowledge. This is not knowledge that is straight from the Quran, and this can be argued. This can be debated. Certainly, somebody can come and expand on this and have their own theories on it. There's nothing wrong with that. So I'm not here to say that this is it and this is how it's going to be. We can have our disagreements, and there are people who do have different different ways of explaining it. I can give you one example. For example, in the past, people have argued that nafs and ruh are the same thing, and there's no difference between the two. And this is in our traditional. If you look up some of the earlier works of earlier fuqaha, so there's no, like I said, this is not qat'i knowledge. This is dhanni knowledge. So there's nothing wrong with having that debate, and certainly that we're not going to argue against that. So this is just the model that we have developed and we have practiced and we're writing on and expanding on and doing our research on it. So if whatever good that has come from it, comes from Allah, and we ask Allah to accept, and whatever bad it is, it comes from our evil and from shaitan, and we ask Allah to forgive. And so I jazakallah khair for your patience. I just want to also mention, just to give you an idea of how we use our teachings. Right? So I was reading this hadith of the Rasul, which really gives you an idea. Like if you look at the APA, American Psychological Association's Code of Ethics, they have this preamble, and it talks about like beneficence and non-malfeasance and confidentiality. And you read this hadith of Rasul sallallahu alaihi wasallam. This is one hadith where these four concepts are mentioned in one hadith. Where Rasul sallallahu alaihi wasallam said, "Man nafasa an mu'min kurbata min kurbi dunya nafasa Allahu anhu kurbata min kurbi yawm al-qiyamah." Whosoever relieves a believer from a hardship from this hardships of this world, Allah will relieve a burden from the burdens of the Yawm al-Qiyamah. Okay, وَمَنْ يَسَّرَ عَلَى مُعْسَنٍ يَسَّرَ اللَّهُ فِي الدُّنْيَا وَالْآخِرَةِ. Whoever eases a difficulty from this world, Allah will eases from this world and akhirah. وَمَنْ سَتَرَ مُسْلِمًا سَتَرَهُ اللَّهُ فِي الدُّنْيا وَالْآخِرَةِ. Whoever covers the problems of a Muslim, Allah will cover from this world and hereafter. وَاللَّهُ فِي عَوْنِ الْعَبْدِ مَا كَانَ الْعَبْدُ فِي عَوْنِ أَخِيهِ. Allah will continue to help the servant as long as he will continue to help his brother. I mean, this is like the preamble of the APA Code of Ethics right here, right? That the Rasul sallallahu alaihi wasallam, laid it out for us. So, anyway, Jazakallah khair for your time. I appreciate your patience, and I will take any questions that you may have. Barakallahu feek. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khairan. Thank you so much, Dr. Fahad Khan.